Before I started, I wanted to reflect very briefly on two of the presentations from the first session. And both presentations are actually extremely challenging to then follow as someone who's worked on a cash transfer over the last couple of years. So first of all, from Santosh Matthews' presentation, and I should say that Santosh was the secretary in Bihar when we were putting up this cash transfer design to the government, and was instrumental in ensuring ministerial and cabinet approval. Slightly ashamed that he's not able to stay and hear the results of one of the things that he managed to launch in his 2 months as secretary in Bihar. But I guess it does slightly insure against the possibility that he came away thinking that it wasn't worth the use of a very small amount of political and social capital that he had in such a short period of time. But I thought, there were two key points out of that for me, one around the sort of political dimension of nutrition, but the other one about the sort of practical dimension, around what's feasible for government to deliver at scale, and thinking about some of these things in very practical terms, not just in sort of academic and research terms. Second, the earlier presentation from Harold, I think is even more challenging because it shows very clearly that there's a limitation to what you can and can't do through cash transfers, and the implications for outcome level and stunting level outcomes. It's a very difficult set of pathways, and I think those 2 points, the practical point from Santosh and the evidence point from Harold, are very linked. That there are very strong structural challenges to achieving more from cash transfers when you're thinking about what government can do at scale. And I think that's one of the major contributions to some of these sort of synthesis findings coming out. So I wanted to talk a bit about the work that we've been doing in Bihar in light of those two challenges, one around what's really feasible and practical for government to consider doing at scale, but also in light of some of the challenges thrown up around the fact that cash transfers on their own are very difficult to actually have much impact on final outcomes unless you can solve some of these other big intractable problems. So just one introductory slide. So the scheme that we've been supporting, the government of Bihar, the Social Welfare Department in 2011 or 2012, requested the UK government, DFID, to support them to design and roll out and evaluate a conditional cash transfer. Very excited about some of the evidence coming out of Latin America. And through DFID's SCHWOSS program in Bihar, OPM were contracted to support the government. But to reiterate, this is a government pilot that's being implemented by government. We've contributed to the design, we've given some light touch support to implementation, and I'll come back to how I define light touch a bit later on. And we're running an evaluation alongside. It's a quasi-experiment, difference in differences model. What we've tried to do with this scheme is because it's a government program being delivered entirely through government systems, at a reasonable scale, it's operational in nearly 300 villages in 2 blocks in slightly different configurations, is really to try and test not just the concept of a cash transfer and the kind of impact that it has, but also about whether it's possible for a fairly dysfunctional district and block level administration to deliver the kind of systems required to make a cash transfer work effectively. Those are systems for registering beneficiaries, monitoring of conditions, payment of funds, grievance redressal, communication, etc. We are testing through the impact evaluation the effect on all the things that you would expect. The alluring part of a conditional cash transfer is that you have these 2 broad effects. One, the effects of the conditions and the change in behavior and service delivery uptake that the result of the conditions, and then the effects of the cash and all the different impact pathways through that. But a lot of our focus has been on the sort of deliverology aspect. How you can make this stuff work through government at scale. So we've been pre-piloting this with the government since late 2013, and it was scaled up. We're operating in 4 blocks in Gaya district. And it's been operating at full scale since September 2014. We have 2 treatment blocks with slightly different designs, which I'll come back to. One pure control block and also a control block that's just getting some of the supply side interventions that underpin the delivery of the cash transfer. So we can also try and isolate some of these different effects. I mean, the broad design is that women enroll when they reach the 2nd trimester of pregnancy. They're eligible to receive 250 rupees per month throughout pregnancy and until the child is 3 years of age, if they meet the various conditions attached to the program. We've also got some outcome bonuses of 2,000 and 3,000 rupees, which I'll come back to because it's a particular part of our design. But over these 3.5 years that a woman would be eligible to be part of this scheme, if she met all of the conditions, she would receive 15,500 rupees. 250 rupees is quite a small amount of money, especially compared to some of the figures being discussed in some of the other presentations. Where we are now, it's been live at scale for a year. We have over 7,000 beneficiaries, nearly 7,000 beneficiaries registered. We are just completing the first midline survey. It's 95% complete. Some of the figures that I'm going to put up are from the 95% of the data that we've already got, which isn't cleaned and isn't compared to the baseline, but is used, I think, more to illustrate a point rather than to be too suggestive of evidence. And just to give a sense, I mean, last month of the 6,700 odd beneficiaries that were enrolled, 72% of them met their conditions and received payment. I'm going to jump around a bit, but I wanted to talk, I think, I know I don't have much time, but mainly around the conditions part of a conditional cash transfer. Because I think the point that I wanted to make is that you are extremely limited as a program designer on the kind of things that you can actually include as conditions in a conditional cash transfer. There are lots of things that we know impact on nutrition outcomes, but not all of them make good conditions. I mean, some very obvious points in this sort of first part, but there are lots of things that you would want to change, especially in terms of behaviors that are very difficult to monitor and verify. So if you have a conditional cash transfer and the architecture is if a woman meets a condition, then you give her the money, you have to be able to measure whether or not she's doing it, and you have to be able to verify that the reporting of that is true. So things like open defecation, hand washing with soap, a lot of the stuff around sanitation behavior, it's very difficult to put in as conditions in a conditional cash transfer. Otherwise, there's lots of possibility for gaming. I think the other broad point is that with a conditional cash transfer, you're assuming a few things if you think there's going to be impact from the conditions. So first of all, we're assuming that for the particular condition, whether it's availing a service or changing a behavior, that there's a relatively high elasticity of behavioral change or service delivery demand with respect to the value of the transfer. So for some conditions that are difficult to access, beneficiaries aren't particularly interested in, a very small amount of money may be not enough to change behavior. For other conditions, a small amount of money might be enough to trigger a change in behavior. You're also assuming that when there's a change in demand for services, that those services exist, that those services exist at a decent quality, to think that outputs can start to translate into outcomes, and there's lots of discussion on that earlier. And I mean, there's a few other points here, but you're essentially looking at a mixture of conditions that work as conditions that you can monitor and verify, that you think are going to trigger behavioral change or service delivery uptake that in itself will improve outcomes. I think there are some agency and ethical issues Breastfeeding is a good example. Nutrition outcomes would undeniably be improved if more women breastfed. Therefore, it's quite a nice condition to think about. But what's good on aggregate is not necessarily good for an individual woman. I don't know anything about breastfeeding, but I understand it's difficult, and especially if a woman is underweight and anemic is very difficult. So to deny her money if she's not breastfeeding when it's incredibly difficult for her to do so is a tricky set of agency and ethical issues. But I think what I wanted to get across is that designing a conditional cash transfer and the selection of conditions is complex, and you have some of your, or at least one hand tied behind your back in terms of impact, that there are things that you can tag to a conditional cash transfer and there are things that you can't really. And I think in general, and I think this sort of underpins some of the stuff that some of the evidence coming out from Harold's presentation, is that the further down the results chain you go in the impact pathway, the harder it is to incentivize. It's easier to incentivize obvious things like attending a village health and nutrition day. It's very hard to incentivize things like if your child gets weighed and is shown to be underweight, therefore going to a nutrition rehabilitation centre. I'm going to speed up a bit, but out of interest, these are the conditions that we have. They are mainly service delivery conditions and not behavioural conditions, because I think it is very difficult to have behavioural conditions. I should say in our two treatment arms, we have one treatment arm where there's just 4 fairly basic conditions, the one at the top, so around attendance at Village Health and Nutrition Day, weight gain monitoring for women, weight monitoring for children. I mean, one of the problems is, I mean, in Bihar at least, that growth monitoring of children doesn't happen. It's weight monitoring, and that does create some issues. And correct treatment of diarrhea with RS and zinc. In another block, we're trying 8 conditions, so we have those 4, and then we have another 4 as well. Measles vaccination, which I mean is sort of one focus on reducing diarrheal incidence, as well as the treating of diarrheal symptoms that come from RS and zinc. Exclusive breastfeeding, issues aside, birth registration and receipt of IFA. And one of the things that we wanted to do with this work is also test these different conditions. Which of them seem to change behaviour and which of them don't. Because there are a large range of things that you can't attach as conditions that we know are important. I mean, I think in M&E terms, you would talk about these conditions as being outputs. I'm glad she's here today, but we had a visit from Sheila Veer to come and see our pre-pilot in 2014, and she made the point that all these things that you're incentivizing are outputs, and as such, they're actually a narrow range of outputs. Why aren't you just incentivizing outcomes? Why are you rewarding women for doing things that contribute to outcomes? Why don't you just reward women for achieving positive outcomes? Which actually hasn't been done in any other cash transfer that we're aware of. So what we did with that is we've added this outcome bonus. So when a child reaches 2 years of age, if they have their weight monitored and they're found to not be underweight, then they get a 2,000 rupees bonus. Same if after 36 months they get a 3,000 rupees bonus. And I think this is something we're quite excited about, is adding in this kind of outcome bonus that you're also incentivizing all these other things that you can't put in as output conditions in a cash transfer. I mean, I don't want to go overboard on that. Yeah, that's a preview of things to come. These are just some very indicative results coming out of our midline. This is maybe too small to see on the screen, but in the top left box, we have the 4 blocks, our 2 treatment blocks and 2 control blocks. And the figures are the proportion of children under the age of 1 who've attended village health, sanitation and nutrition days at least twice in the last 3 months. What you can't see, I mean, so first of all, there's an extremely strong effect size. The attendance at village health and nutrition days is going from about 10% to sort of 30-odd%. It's a strong effect size, but it's still quite a low overall total. Even with these incentives, we're only getting up to 30%. The next one is those children who've had their weight measured at least once at a Village Health and Nutrition Day. I mean, there was a point earlier that just having your weight measured doesn't mean anything unless you know how to interpret the data, and the worker knows how to interpret the data. We have got stuff on the app that then the mobile phone that underpins the transfer architecture does tell the worker if that level of weight for the child's age is a problem, and then plays a behavioural message to the child. And this figure is showing the percentage of children for who had diarrhea treated correctly using ORS and zinc. So also a pretty big effect size from treatment to control. The figures are tentative, and it wasn't so much the results, but I think it was just reinforcing that all of the global evidence, as Harold was saying, shows that conditional cash transfers are a fairly effective lever at increasing outputs, changing behaviours, increasing service delivery uptake. The further downstream impact is more challenging. And what I just wanted to say on this is we did make some very particular design choices. These are things that ICDS are meant to deliver. What we've done with a cash transfer is try to put in conditions that promote uptake of existing services. So you're layering on a cash transfer onto an existing service delivery landscape. There are lots of other things that you could do to make it more effective, around behavioural change communication. But what we're trying to test here is a specific policy lever. If you have a service delivery bundle that is by and large delivered, but the uptake is quite low, is a cash transfer an effective lever to increase uptake of those services? So there was a particular design choice as to why we've just done that, and why we haven't tried to do other things. I know I'm over time, but I did just want to probably finish on nearly finished on this one slide. Our cash transfer is the government gives out the money, the government transfers it from a bank account using NEFT transfers. You'll guess where this is going from the picture. What we've discovered is that, the cash transfer works fairly well. We give Anganwadi workers mobile phones to register women, to report on data. That all happens fine. The actual systems problem we have is actually giving the money out. And you would think that, what happens is from our MIS, we get a payment instruction that's a list of women and bank account numbers, and we give this to a bank, and they process it through NEFT. NEFT is the system whereby a bank can transfer into accounts in other banks as well. We found this to be quite challenging. First of all, it's surprisingly difficult for women to open bank accounts. There are RBI circulars last year that instructed banks to relax KYC norms so that you only need one of an identity or an address proof rather than both. Needing both was a big barrier to opening bank accounts. What we find at the district and block level is that is completely ignored by most bank branches. Most bank branches also don't actually have the software to deliver NEFT payments. So giving a set of payment instructions to a bank saying, here are these 7,000 women, please execute these transfers, a lot of bank branches don't actually have the physical capability at district and at block level to do that. You want the transfers to happen at district and block level for another reason which I'll come on to. The DPO in Gaia has an account with SBI. SBI just cannot process bulk transfers, and thankfully HDFC in Gaia is the only bank that can process NEFT transfers, and they very generously do this on behalf of SBI. I think just two final points. It's very difficult to get bank account numbers right. We see banks writing down the wrong account numbers on beneficiary passbooks. When Anganwadi workers register beneficiaries, it's easy to get the bank account number wrong. It's easy to get the IFSC code wrong. It's very easy to mix up an O and a 0. The levels of transcription errors when you're enrolling beneficiaries into this kind of program is very high. And what we found the first time that we sloshed money through the system and released transfers, 18% of those transfers bounced back because the bank account numbers were wrong. We were able to solve all of that by going and working out where these problems were and going back to beneficiaries and put in more checks to avoid these problems. And eventually the bounce back payment comes down to a fraction of 1%. But it does require a degree of infrastructure and architecture to go and solve these problems. If you have transfers bouncing back, someone actually has to go and work out why the account number was wrong. And I think that's quite difficult to do at scale. We have a small team supporting the government that do a lot of the legwork for this. If such a scheme was delivered at scale, we'd need to think a lot about how you would put in the architecture to deal with some of these issues. But I think just a general point that the banking architecture in rural India, and especially in rural Bihar, is significantly less competent than they would sometimes have you believe, and actually becomes quite a major impediment to delivering cash. Sorry, that's a pet bugbear. Just to finish, I know I've run over time. We did ask in our midline survey the cash versus food question, and for both women who were enrolled in our scheme and receiving cash, and those who were not enrolled or in the control areas, both of them have extremely strong stated preferences to receive cash over food. And I just wanted to say that I don't think that's such an obvious conclusion as it might seem. I mean, my final reflection, and I wanted to then come back to Santosh Matthews' point, is the scheme that we're supporting the government to run, I mean, functionally works quite well. A lot of women get money in their bank accounts every month. I mean, the systems and architecture work fairly well. Beneficiaries, in some of these extremely poor villages, actually end up with something in hand. The food distribution system under the take-home rations and hot-cooked meals doesn't work very well. So I'm not sure this is necessarily a sign of innate preference for cash over food. May well be. I think this is an innate preference for whatever works to actually get something to households. And I think that comes back to Santosh's point that one of the things to think about is what's most feasible for government to deliver at scale. It's a very constrained maximisation. I had lots more to say. There was a 1-minute sign that went up about 5 minutes ago, so I think I'll stop there.